These abbreviations are used during the video.
The ischial tuberosity, known as the sit bone, has distinct facets that serve as proximal attachment points for the hamstring muscles. The lateral facet primarily anchors the semimembranosus muscle, while the medial facet anchors the conjoined tendon of the long head of the biceps and the semitendinosus. The long head of the biceps originates with its free part of the conjoint tendon from the lateral part of the medial facet via a thick, round tendon that has some connections with a small portion of the fibers of the sacrotuberous ligament. The semitendinosus has insertion sites originating medially to and partially from the conjoint tendon at the medial facet via thick connective tissue and a thin aponeurotic tendon that covers the anterior surface of its muscle that extends furthest proximally. The semimembranosus is named for its extensive membranous proximal tendon. It attaches to the lateral portion of the ischial tuberosity. After identification of the hamstring origin, we follow the structures distally till the semimembranosus tendon lies directly below the conjoint tendon of the long head of biceps and semitendinosus, in close relation to the sciatic nerve. The conjoint tendon is marked with an arrow. The semimembranosus tendon lies below the conjoint tendon in close relation to the radiating muscle fibers of the semitendinosus muscle, which lies at the medial aspect. During dynamic scanning, we focus either the semimembranosus or the conjoint tendon and observe the crossing of the tendons. From this position, we can rotate the probe clockwise to check the tendons in a longitudinal orientation. The semimembranosus is marked with an arrow. The conjoint tendon of long head of biceps and semitendinosus lies on top of the semimembranosus tendon. By moving the ultrasound probe, we can examine the myotendinous junction and check whether the tendons are intact. Dynamic maneuvers with flexion in the knee joint are also possible. This patient presents with an acute complete tear of all hamstrings and the distal sacrotuberous ligament due to trauma. The ischial tuberosity shows bony irregularities in the transverse plane. The arrows indicate the presence of edema and hematoma. Moving the probe more distally, the retracted semitendinosus muscle can be seen with the surrounding hematoma. This ultrasound image shows a partial tear of the conjoint tendon and the semitendinosus on the right. Comparison with the healthy left side demonstrates loss of tendon texture, hypoechoic swelling, and hematoma on the right. In the longitudinal view, the sacrotuberous ligament, which is visible at the beginning, is intact. The semimembranosus tendon can be visualized continuously, whereas the conjoint tendon with the semitendinosus shows distinct textural disturbances. This patient suffers from chronic tendinopathy of the left hamstring origin. The tendons show hyperechoic swelling, possible calcifications and irregularities. In the longitudinal view, starting the scan at the level of the sacrotuberous ligament with the underlying obturator internus muscle, the ligament appears intact. Further distally, possible calcifications of the tendons can be visualized. In the same patient, an ultrasound-guided injection with autologous conditioned plasma was performed using the in-plane technique. The ultrasound probe was oriented along the sacrotuberous ligament to ensure safe and easy access. Using the beam steering technique, visible through the dotted line, the angle of the ultrasound beam was optimized to improve visualization of the 25G needle.